Thanks very much, Matt. Okay, so I'm going to talk about how to diagnose and manage sports-related concussion. And I'm going to talk about what the issues are around concussion in sport, the landscape at the moment. I'm going to talk a little bit about what concussion is and what it isn't, and how to diagnose it. And I'm going to talk about how we manage uncomplicated concussions and how to manage prolonged symptoms following concussion. So in sports-related concussion, I kind of split the issues up into the issues that occur on the field, and they include management of the acute injury, which is really what a lot of the sporting bodies and media have been focusing on. And this is just an example from the World Cup final a few years ago, where a German player in the first few minutes was knocked out cold. You can see him there, spread-eagled on the turf, and carried on playing for the rest of the half after being given the magic sponge. And then the story is at halftime, he asked the referee what match it was, which suggested his brain wasn't working completely properly. And that's a sort of example of poor management of acute injury, which we've been trying to avoid. And when I started this, I was kind of, I still possibly don't understand why people are so obsessed with avoiding players continuing following concussion. I think historically, there were a lot of concern about second impact syndrome. And this is an example, a tragic case of a young rugby player who had a head impact during a match, and then a head impact a few minutes later, and then died of catastrophic brain injury. And this is incredibly rare, but it really drove concerns about getting people off the pitch to avoid further injury. But in fact, much more common than this is an incredibly rare occurrence, is people that have got concussions are very bad at their sport while they're concussed. If they get further impacts, they can get more severe symptoms and more prolonged recovery. And this is really what drives the more modern management. And then we also know that following a concussion, there's a much higher risk, a six-fold risk of increased musculoskeletal injury for the next 6 months. And this is some data from rugby showing that the bottom curve is following a musculoskeletal injury, and the top curve is following a concussion. You can see the separation there. There's an increased risk of all injuries. And that suggests that the rehabilitation following concussion is possibly not all it should be. Then there's issues off the field. And this is Saracens captain, or the ex-captain of Saracens, who I saw and who had to retire due to persistent symptoms from a concussion at a fairly young age. We've all heard about the long-term effects of heading a ball. Potentially, that's Jeff Astle, who a coroner said died of early onset dementia due to employment causes. And this has now become a major legal issue, and there's nearly 300 retired rugby players in a class action against the English, Welsh, and World Rugby unions that's going to come to a head mid this year. And all of this has led to reduced participation. And on the left there, you can see a device that people can buy in the States. It's an American football helmet with some sensors in that go straight to mum and dad's mobile phone so that they can pull you off if you have an impact. But the effect of all of this is reduced participation. And there we can see what especially kids are going to do if they're not doing sport. And that leads to all sorts of additional health issues that we should probably be concerned about. So what about the scale of the problem? Well, it kind of depends what sport you do. Horse racing with jumps is a very high rate of brain injury. Boxing's pretty high. Rugby's high. And you can see American football's incredibly low there. And that's because they fiddle the data, because each player probably only comes on for a few minutes per match, and that counts as hours, player hours. But in fact, the rates in NFL are higher than rugby, or they certainly were. They're probably not anymore. And this is a graph showing the diagnosis of concussion in Premiership rugby over the years. And you can see that in 2013, 2014, there was a huge spike. And that was not because of any change in the game. That was with the introduction of better pitch side assessments, the head injury assessment. And the rates have been going up every year until this year, in fact, where they've been reduced by about 30%. And that's because of better diagnosis, not because of changes to the game. And on average, then in a professional rugby match, there's one concussion diagnosed per match, or certainly was until the beginning of this year, which makes it the commonest injury in professional rugby by quite a long way. So what is concussion? Well, it's actually a pretty difficult question. And I think one of the issues around this area is concussion means different things for different people. So some people talk about concussion as the symptoms you get when you hit your head. Other people use it to mean a mild traumatic brain injury. And other people use it to mean various other things. But really, it's a syndrome. It's a constellation of symptoms of signs, such as things like loss of consciousness, confusion, ataxia or balance disturbance, sleep-wake disturbance. But the problem with this is that there's lots of systems around the head and neck. There's the oculomotor system, the vestibular system, the cervical musculoskeletal system, the autonomic system, visual system, etc., as well as the brain. They're all interlinked. And dysfunction and damage to any of those systems leads to the rather generic set of symptoms that people with concussion complain of. So, not all symptoms after head knocks are due to brain injury. And I think that this is one of the very confusing aspects, both acutely and when we talk about prolonged symptoms and things like post-concussion syndrome, which means even less to me and more to different people. It makes the whole area a bit confusing. So we'll try and get through that as well. So what is going on in the brain in a mild traumatic brain injury or concussion? Well, I mean, this complicated diagram essentially shows that there's a biochemical electrical cascade due to trauma. You can see the long axons there, very susceptible to trauma. The proteins that hold the shape of axons together are things like tau protein, and that can get released from damage, and maybe the link between the acute injuries we see and possible problems later on, because tau is a cytotoxic protein and has been implicated in neurodegeneration. But basically although as we'll go on to see, brain imaging is often completely normal following the sorts of injuries sports players get, head injuries, there are microscopic things going on in the brain due to the forces the cells are exposed to. So the current management of sports-related concussion and head injury is the 4 R's. So it's recognize the injury, remove the player from play so they're safe, rest, and then return to play, and return to studying, return to work protocol. And the problem with this is that the diagnosis is really difficult, or can be very difficult. It can be very easy. I mean, if you see a player that is knocked out and unconscious, it's a pretty straightforward diagnosis, but actually loss of consciousness is only present in about less than 10% of sports-related concussions. And there have been various tools that have been developed. This is the pocket concussion recognition tool, which is a kind of clinical kind of reminder that you can go through to help make the diagnosis. The trouble is, as I already said, the diagnosis is not specific. So for instance, somebody that gets a head injury and then is very dizzy, it could be a problem with the inner ear, something like benign paroxysmal positional vertigo, and nothing to do with a brain injury. We know from the professional game that observable signs such as brief loss of consciousness or balance disturbance are often absent, or they can be missed. And very detailed video from different angles in professional sport can pick things up, but in the amateur game or when no one's really watching, these are often missed. There can be delayed onset of symptoms, and I've had people presenting a day or two after their injury. Things can be complicated by alcohol. Very commonly, people go out for a drink after they've played sport and then don't realize that the severe hangover they got the next day was due to the head impact they sustained. And as David Sharp will talk about in the next talk, we really don't have very good objective biomarkers of brain injury that we can use to nail the diagnosis. And the vast majority of patients that we see, even with quite severe sports-related head impacts, have completely normal CT and even MRI imaging. So, recognize is hard, but can be done. So what's the role of rest? Traditionally, this was the kind of, the mainstay of treatment of concussion. I still see lots of people that, have a head impact in sports or in other environments, and they go to A&E or they see their GP and they're just told to rest and do nothing until they get better. And sometimes that's 3 years. So it's not necessarily, and I found that a little bit odd because in neurorehabilitation, which is my background, we don't really rest people. If someone has a stroke over their very acute presentation, a day or two later, we start rehab as soon as possible. So what's the evidence? Well, there is actually some evidence that abstinence from screen use for the first 48 hours reduces symptom duration. It's not amazing evidence, and it's mainly in children, but there at least is some evidence. But actually, there's very good evidence that rapid return to normal activities reduces symptom duration, both in adolescents and in adults. So really what we tend to do is tell people to have relative rest as symptoms allow for the first couple of days after a concussion, but then really try and get back to things. If there are very specific things that aggravate their symptoms, that's actually pretty helpful in trying to understand what's going on and how to treat them. But doing nothing really doesn't help very much. So once people have got over that relative period of rest, then they tend to follow the graduated return to work, education, and sport. And this is from a really good piece of work from the Department of Culture, Media and Sport, which produced some grassroots concussion guidelines. And basically, there's various stages of a return, and you can see it there. You start light and gradually increase over time. And there are sports-specific return to activity. This is from rugby. And the idea is that you start with some aerobic exercise, then skills, and then the last thing you do when people have been asymptomatic for a period of time is contact sport. And really, there have been quite a lot of issues with different protocols for different sport, but the grassroots DCMS guidance has really tried to unify that and basically has come up with a 3-week period of avoiding contact following a concussion. The evidence basis for that is not particularly clear, and in the professional game, people get back much quicker than that, but it seems fairly sensible. So what happens after a concussion or a head impact in sport is that the vast majority of people get better pretty quickly. This is a recent study of around 4,000 college athletes in the States who suffered head impacts or concussions in their sport. And all of these graphs are different symptoms or cognitive testing, and they all had baseline symptom scores and cognitive scores, and the graphs show the time taken to get back to baseline. And basically, in terms of symptoms, the vast majority, over 90%, were back to normal within 7 days. Cognitive functioning, such as speed of processing and learning, new learning and memory, in a group of people took a bit longer, but still the vast majority were back to normal within 2 or 3 weeks. So that does provide some rationale for the 3-week avoidance of contact. But what happens to the group of people who don't recover. And the numbers vary, but it's probably around 10 to 20%, even more in certain populations. And this is what my clinic is really populated with. And the way I think about it is these people have multiple symptoms and there's usually multiple causes. And this is a classic sort of patient that I'll see in the clinic, 22-year-old university rugby player who had a head injury playing rugby with no loss of consciousness, no amnesia, could remember everything. And 3 months later, he's complaining bitterly of cognitive complaints, headaches, fatigue, poor balance, visual vertigo, which is a kind of a really unpleasant sensation of imbalance and disequilibrium in busy environments, anxiety, and poor exercise tolerance, symptoms much worse with exercise. He's unable to work, study, or play sport, which is a disaster for this university-going rugby player. So back to this, as I said before, acutely, the symptoms are pretty generic and come from all these different systems. And that's the same thing chronically. So a kind of proper clinical assessment found that his headaches were migrainous. We can treat those. His vestibular system was abnormal. We can treat that. His brain scan was normal, which is great because he was convinced he'd had a severe brain injury and was never going to get better. And his cognitive problems were all problems of attention, which attention's impacted by all these other factors: pain, poor sleep, low mood, not brain damage necessarily. He had really low mood and anxiety, and he could tolerate exercise as long as he kept his heart rate low and didn't move his head. So in this situation, the problem was multifactorial, coming from multiple systems, and treatment of all those different things, of his migraines, his vestibular dysfunction, his low mood, and his autonomic dysfunction, he got better pretty quickly. So in my experience, prolonged recovery is caused by commonly migraine and other headache syndromes, vestibular problems, cervicogenic musculoskeletal issues, functional cognitive issues, which I'll talk a little bit more about, and mood disorders. Autonomic hypersensitivity is much less common, but we do see it, and rare, but what most patients and quite a lot of doctors worry about is a more severe brain injury leading to permanent cognitive impairment. So functional cognitive symptoms we see a lot, and these are the sort of things that people describe: walking into a room, not knowing what they're doing, having difficulty finding words, forgetting conversations, being okay when they're really focused, but not when they're concentrating on something else. And these are all attentional issues. And this little scheme is just is a kind of diagram showing how people that have suffered a concussion can go on to get in this loop, doom loop of concerns about their cognition, hypervigilance, worsening symptoms, and it can be incredibly disabling. And actually education around what's going on can be incredibly helpful rather than any specific intervention. So the management strategies that we tend to use are education around the injury and about what does happen and what doesn't happen, reassurance that the vast majority of time there isn't a severe permanent brain injury, treating migraine, treating vestibular issues with rehabilitation, and supervised reintroduction of exercise, work, cognitive load studies, and quite often psychological interventions such as antidepressants, anxiety treatment, and psychological interventions such as cognitive behavioral therapy. So what about multiple concussions, which is, again, a very common thing that I see in the clinic? Well, there's very little evidence regarding management. There's some evidence that they may lead to more and treatment-resistant symptoms, but that's not really clear. There's no magic number. If you've had X number, 5 concussions, it doesn't mean you will get dementia or you should not play sport ever again. Generally, if people have quite a few in quick succession, say 3 within sort of 6 to 12 months, we tend to consider a stand-down period without contact for 3 to 6 months. Not really evidence-based, but seems sensible. And there are concerns about the long-term effects of concussions, but also subconcussive events. So these are impacts that don't cause symptoms. And I think that for a long time, people have focused on symptomatic head impacts, but actually the evidence is accruing that it's a dose issue in the longer term. And we should probably be concerned about all head impacts, not just symptomatic head impacts. That's probably not reassuring for your average footballer or rugby player or boxer, but it is important. So just a little bit about the clinical service at ISEH. So it's been running for 10 years nearly. It's a weekly multidisciplinary clinic with neurology, sports and exercise medicine, and specialist physiotherapists. And as well as me, there's a couple of the other people there. There's Mike Loosemore, who sees under 16s. There's Maggie Stacey, who's an absolutely fantastic vestibular physiotherapist who does most of the work. And Theo Farley, who is a concussion physiotherapist who particularly specializes in getting people back to exercise and work, and as well as musculoskeletal physiotherapy, is really good with autonomic dysfunction. So we've seen a lot of athletes of all ages and all sorts of sport, and we've started seeing a lot more non-sporting head injuries and mild traumatic brain injuries over the past few years as the clinic has become better known. The main referral reasons are chronic symptoms, delayed return to play or work, multiple events, cognitive issues, and I see, if there is a more severe brain injury in a sportsman, they tend to come to our clinic. We've got really close links with psychology, neuropsychology, and psychiatry if needed. And there is the email address if anyone wants to contact us or has any patients that might benefit from the service. So just some conclusions. Sports-related concussion is common and is a significant problem at all levels in sport. It's managed a lot better in certain sports at higher levels, but is still probably undermanaged and missed in grassroots sport. In acute presentations, it's really difficult to delineate the extent of brain injury. And that's one of the reasons why they have to be taken seriously and managed as if there had been a more significant brain injury to prevent further problems. People with persistent symptoms, they need the cause of their symptoms diagnosed and treated aggressively and early. The longer the persistent symptoms go on, the more treatment resistant and the more psychologically mediated they tend to become. But the vast majority of people, if they're treated correctly, diagnosed correctly, get better pretty quickly, actually. And the interventions are very straightforward and don't require huge amounts of fancy equipment, testing, or money. Thank you. That's all.